Hi, a very good evening, all of you. So, how are you guys doing? So, today's live session will focus on COVID-19 discussion. Okay, we'll review plenty of information relevant to COVID-19, and also in the process, we'll have some patients discussion too. Yeah, please confirm the audio and video streaming. We'll start our session as soon as possible. Okay, fantastic to hear. So, a very good evening once again, each and every one of you. I hope you guys are all doing good. So, before we start our COVID 19 discussion, I have some relevant topics to discuss, and then we'll jump into our COVID 19 discussion. And at the end of the session, we'll try to review the information given in WHO websites and cover various important points accordingly. So, first and foremost, I wanted to start with this. This afternoon, actually, I had a thought for quite a long time that I should conduct a live session, a silent live stream, which helps you, to meditate. Music would be wonderful. Adding music would be wonderful, but even without music, if you have good visualization, you can meditate effectively. So, with that objective, I actually streamed a live session for around 2.5 hours. The response was very good, and I focused on the sky. This first live session, this first ever silent live stream session. And after concluding this video, after ending this stream, I've added some additional information in the description part of the video. So in case you guys missed that particular live stream which I conducted this afternoon, I suggest you to go through the same, the description part of the video, where you'll find guided meditation steps, like what all you can actually do to help you focus on various aspects, including preparation. And it's a very simple technique, which I'm sure and I'm confident that would enhance your overall senses, especially in crucial times. And I'm actually planning to conduct more of these sessions, silent live streams in the afternoon, especially between 2 to 5 p.m. because 2 to 5 p.m., I understand it's a very, very challenging time. Very, very challenging time. We eat, we have our lunch, and then we feel drowsy. So, how are you going to be more active during this particular time period? This is definitely a challenge. And let's get used to this challenge and overcome the same. So, you can have minimal lunch or you can minimize the amount of food you take. Usually, in our scenario, we consume lots of food. As they say, we should have lunch like a king, if I'm not wrong. I think lunch like a prince, breakfast like a king, and dinner like a queen. I heard of that quote during my schooling when my teacher actually told me the same. So we have this habit of consuming lots of food. So obviously, the circulation will be diverted towards the digestive tract, and that's the reason why we feel drowsy after a heavy meal. So minimizing meal to such an extent that it helps you stay active. And by following certain techniques like a simple meditation, which is nothing but being observant about your own senses, and you can actually use various visualization techniques and also breathing, right? You can focus on inhalation, exhalation techniques, and then you can do this consciously. I mean, we all inhale and exhale. It happens at subconscious level, but if we can do it consciously, we are bringing, we're getting more alert. We're becoming more aware of our surroundings, which I'm sure, and as science is proving day by day, that it's going to enhance our overall capabilities. So with those objectives, we streamed a live session. And after this session ended, I tried to play that video in fast forward, and here is the result. So let me show that video to you, and then we'll move on to our case-based discussion and COVID-19 discussion. Fine? Yeah, here you go. So this is actually, you can consider this as a time lapse. We started streaming this video at around 3 p.m. Yeah, 2:30, I reckon, around 2:30 p.m. And then we streamed it till 5:45 or till 6 p.m., almost 2.5 hours. So you can use any visualization technique, or you can simply close your eyes and then focus on breathing. And as I mentioned in the description part of this video in YouTube, while you're inhaling, just imagine that you're imbibing all the positivity that's present in nature, inspired by these images. And when you're exhaling, Just visualize or imagine that you're just eliminating all kinds of negativity from yourself, your mind, and your body. It's a very powerful technique. It's very simple yet very powerful technique, which I'm confident is going to help you enhance your overall capabilities, right? So this is the stream, which is in fast forward. So you can consider this as a time lapse, a 3-hour video almost condensed to around 7-minute video. So let me just go further forward and then we'll proceed to our case-based discussion. And in this format, if we can really capture sunrises and sunsets, it would be even more amazing experience, right? So let me just stop it and we'll move on to our presentation now. So another amazing picture from Switzerland. So you can see a combination of different colors, green trees, blue sky, white clouds, snowy white mountains, an amazing picture. So it's not just in here. I've showed you different pictures from different countries. Mother Nature is indeed always inspiring. So whenever you feel low, whenever you feel demotivated, whenever you feel like giving up, just be observant and focus on yourself. That is, just take care of your breathing. Be conscious about your breathing. And I'm sure you can overcome any kind of challenge, no matter what it is. And the reason why I've been trying to elaborate on these general things is because, especially these last few days, around 1 month before exam, 45 days before exam, or 20 days before exam, or just before exam, times appear to be very stressful. The funny fact is, times always remain the same. It's our perceptions which keep evolving and changing according to the circumstances. So it's all about updating our inner software. So no matter how challenging the situations are, just turn inward, just be observant, and I'm sure and confident that every one of us can overcome any kind of challenge, no matter how complex it is. Just look at these wonderful pictures. Just look into the sky, look into Mother Nature. It provides you all possible solutions to all existing problems humankind is facing, right? And talking about problems, COVID-19 is one such major problem which we've come across. Unfortunately, or fortunately, I don't think anyone would agree to that when I say it's fortunate. So unfortunately, humankind has faced this pandemic. Can I say pandemic? Yeah. So that's the focus of our discussion in today's live session. Yes, Cello, Switzerland. Yes, definitely. So just observe this picture and visualize this when you close your eyes. You are in Switzerland, without any doubt. Okay, very good evening. So we'll start with yesterday's case-based question. So I've mentioned about a case where a patient who wears a complex, complete maxillary denture complains of a burning sensation in palatal area of his mouth. This is indicative of too much pressure being exerted by denture on which of the following anatomical structures: incisor foramen, palatal mucosa, amular notch, posterior palatal seal. So which one do you think is more appropriate answer? I think most of you have answered it yesterday itself. Yeah. So burning sensation, mandibular anterior area is caused by pressure on mental foramen. A patient having trouble swallowing may have insufficient interocclusal space, decreased freeway space caused by excessive vertical dimension of occlusion, which I'm sure all of you are familiar with. And the best dietary advice for an elderly denture patient is to eat foods rich in protein and vitamins. So these are some recommendations. And a patient who wears a complete maxillary denture when complains of burning sensation in palatal area is because of pressure on incisor foramen. Yes, compression of nerves in that particular localized area. To consider this very, very important. And also, I mentioned some additional points which are given in literature. You can just review them later on, depending upon your time availability, right? So option C, yeah, option A is a right answer, incisor foramen. Okay. Now let's move on to our present discussion on COVID-19, our 10th live session. I mentioned this as a quick revision class, and we'll try to complete this as fast as possible. And also, as I said, after this session, we'll try to review some information which is available in the official WHO website, including some information on vaccines. Of late, we have come across some vaccines by Pfizer company, which says it's effective in more than 90% of the cases. Moderna, very recently, they say it's effective in almost 95% of the cases, or 95% effective. So we'll also review some additional information. And in last live session, I mentioned about a mouthwash in vitro study, where they have mentioned that this mouthwash has a capability to destroy coronaviruses in the oral cavity, right, through mouthwash. So we'll also review some miscellaneous information accordingly. So I hope you guys are all ready. So let's start with our first question. Yeah. So which of the following is not a molecular test? So since most of you are asking about several important topics in entrance perspective, I've chosen some select topics. So based on the tests which are available currently, what do you think is more appropriate option among the following? Which of the following is not a molecular test? Blood test, RT-PCR, NAAT test, serology test. So what's your opinion? Even if you have no idea, you have nothing to worry about, we'll review some information. In fact, we discussed all of this extensively in our e-classes, in our debate sessions, in our test series. We'll also try to briefly discuss the same in this particular live session. And let me give you a hint. This question has multiple right answers. It's good to see that you're choosing one right answer. So this question has multiple right answers. So that's a hint I'm going to give you. So in FDA website, Food and Drug Administration, FDA website, official website, they mentioned about coronavirus testing basics. So there are different types of tests. Basically, we can round them to two types: diagnostic test and antibody test. A diagnostic test can show if you have an active viral infection, whereas antibody test will give you an idea about past infection, if in case you had any, right? So we have basically two types of tests: diagnostic and antibody test. So among the given options, which of the following is not a molecular test? And I think most of you are choosing a combination of A and D. Let's get back to that very shortly. So a diagnostic test can show if you have an active coronavirus infection and should take steps to quarantine and isolate yourself from others. Currently, there are two types of diagnostic tests. So overall, we have diagnostic and antibody tests. In diagnostic tests, we again have two types of tests, that is molecular tests and antigen tests. So molecular tests include RT-PCR test, which detect the virus genetic material, hence considered to be the most accurate. And then antigen tests that detect specific proteins on the surface of the virus. See, with antigen test, if the test is positive, it means the patient has coronavirus in almost all the cases. But with antigen test, if the test is negative, you'll have to repeat that with a molecular test, right? So molecular tests, also known as diagnostic tests or viral tests or a molecular test. So we have different types of molecular tests, which include, I mentioned about one, RT-PCR, reverse transcriptase polymerase chain reaction, which is a molecular test. And then we have LAMP test and also NAAT test, that is nucleic acid amplification test. So all of these fall under molecular tests. And then we have various antigen tests and antibody tests. So these antibody tests are also called as serological tests or blood tests. So as you mentioned, options A and D are not molecular tests. They are serology-based or antibody-based tests. And as I mentioned, these molecular tests and antigen tests, they are diagnostic tests because they help in, if they are positive, it means you have viral infection right now. And if the antibody test is positive, that is in case of blood test or serology, which means you have developed the antibodies to a past infection. So it doesn't give us a picture of, it doesn't give us a current picture, right? So that's something which you should understand. So antibody tests show if you have been infected by coronavirus in the past, whereas molecular and antigen tests diagnose active coronavirus infections. That's the bottom line. So as you all rightly mentioned, as most of you rightly mentioned, options A and D is right answer. Okay, good. Now let's move on to our next question. So which of the following is a rapid diagnostic test? So this is related to the very same topic which we are discussing, that is coronavirus testing basics. So which of the following is rapid diagnostic test? Antigen test, molecular test, antibody test, all of the above. So which one do you think is rapid among the following? You might have heard of these rapid antigen tests which are being performed in several places, including airports, including various stations and all, right, to obtain quick results. In fact, I've given you the answer in the process of uttering these words by mistake. So anyways, what do you think is more appropriate answer? Yeah, very good. So molecular tests, they are diagnostic tests. Usually these molecular tests, the results can be obtained in same day in some locations, or it might take up to a week. My father had a surgery, as I said, total hip replacement. So we had to get this RT-PCR, which is mandatory. It took around 1 day, 24 hours. So in some places, depending upon the availability of equipment, 1 day we'll be getting the result, but in some other places, it might take even a week. Whereas antibody tests, same day or in 1 to 3 days. Whereas antigen tests, that is rapid test, which we are talking about now, 1 hour or less. Rapid test, rapid antigen test. Okay. Yeah. Yes, Shetna, I said the answer by mistake because we're so used to this terminologies nowadays, given the current situations we are in, that by mistake I have uttered rapid antigen test. Okay, I'm really sorry for that, but I'm really sure you're all aware of the same. Yeah. So, which of the following is a rapid diagnostic test? It is antigen test. Okay. Right? Now, fantastic. Now let's move on to our next question. Okay. Which of the following is a symptom of COVID-19? Cough, headache, fever, vomiting. It's not as if you're going to write a theory university exam where we mention headache, vomiting, diarrhea, the common effects of or side effects of any pharmacological drug. No, this is not an university exam. So among the following, which one do you think is a symptom of COVID-19? In fact, the symptoms are being updated as we are speaking now. New symptoms are being added. Initially, they mentioned few. Now they're talking about loss of sensation of smell, taste, and even in worst case scenarios, there can be a multi-organ failure, other manifestations, right? So the symptoms list is getting updated as we are talking now. So as per the latest information that's available in CDC, FDA, and WHO website, let's discuss the same. Okay, ABCD. That seems very convenient. Very good. So, which of the following is a symptom of COVID-19? So, people with COVID-19 can have a wide range of symptoms. So, that's a challenge we have. It's not that there can be only 1 or 2 symptoms, wide range of symptoms. And these symptoms can be mild to severe. And symptoms may appear 2 to 14 days after exposure to virus. And the following are the symptoms based on the information available in CDC: fever or chills, yes; cough, shortness of breath or difficulty breathing, fatigue, muscles or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, diarrhea. And there are still so many symptoms that are mentioned in official websites. And it's not that everyone will have symptoms, as mentioned by in the name of statistics. They have clearly given us some data citing that around 80% of the patients can remain asymptomatic. They may not be even facing this or experiencing these symptoms. It's not that everyone, those who are infected with coronavirus, will have these symptoms. So if at all there are symptoms, it can range from mild, moderate, and severe. And these are varied symptoms which are presented in CDC website. Okay, and there can be still more number of symptoms. So you should always keep a tab on the official website. Okay, so all is right answer. Fantastic. Now, seems simple. Let's see how many of you are going to answer it wrong. Because we have been facing this for the past 1 year or so. So COVID-19 is epidemic, endemic, pandemic, none of the above. And we'll take this as an opportunity to discuss various terms like what's an outbreak, what's a pandemic, what's an epidemic, what's endemic, right? So which one do you think is more appropriate answer? Yeah, new post-COVID effect, hearing loss. Okay, Renuka, thank you for the inputs. Actually, it's a multiple right answer, so all of them are symptoms because the same are mentioned in official website. So let's see how many of you are going to answer it wrong. I'm having a close watch on all your answers. So be extremely cautious. So COVID-19 is epidemic, endemic, pandemic, none of the above. In fact, initially it was declared as an epidemic, and then WHO took some time to update this to pandemic. In fact, when we had our first debate session, it was still epidemic, if some of you remember, and then it was updated to pandemic, and then we updated our test series and e-classes discussions accordingly. Okay, I really hope it could have been endemic, but since it's not endemic, it's spread and it's now currently a pandemic. So initially it was categorized as epidemic, if you remember. So an outbreak. So what's an outbreak? The sudden, unexpected, pronounced increase in occurrence of disease, usually focally in limited section of patients like cholera, malaria, etc. Outbreak. And then what's a pandemic? So as you said, pandemic option C is a right answer. An epidemic usually affecting large proportion of population occurring over wide geographical areas such as a section of nation, the entire nation, continent of the world. I'm going to present you this very same image in the later part of the discussion when we visit WHO website. Okay. And what's an epidemic? So the unusual occurrence in a community or region of disease-specific health-related behavior or other health-related events closely or clearly in excess of expected occurrence. That's an epidemic. Whereas endemic which is localized. It refers to constant presence of a disease or infectious agent within a given geographical area or without importation from outside. Like I can say iodine deficiency. I'm sure you all remember this example. So this may also refer to usual or expected frequency of disease within such area or population group. So this is very interesting. Endemic, the disease frequency is usually as expected because it's endemic in that particular area, whereas epidemic, the health events that occur are clearly exceeding the expected occurrence. So this is one distinct difference which we have between an epidemic and endemic. Pandemic, pan nation, pan spread over the entire world or through continents or geographical areas. So pandemic is a right answer. Okay, right. So initially it was the epidemic, but it has been later updated to pandemic. Well, let's see how many of you are going to answer this right. So you have a hint on right side in the form of an illustration. We have a beer named as Corona. Okay, coronavirus is named based on a beer, chocolate, structure of virus, none of the above. So which one do you think is more appropriate answer? In fact, coronavirus, this is not new virus to us. COVID-19, which is caused by SARS-CoV-2, it's definitely a new virus. But coronavirus as such is not new to humans. Cold, viral infection, it's one of the viruses that causes cold is coronavirus. So virus that causes cold also belong to this coronavirus family. The name of the virus derives from, I'll review this information a bit later. And coronavirus has been known since 1937 when it was isolated from chickens. Now they're talking about bats. I think it's still not clear in Wuhan, China. So initially it was first isolated from chickens. It was suspected of being a cause of colds, but this could not be proven until 1960s when techniques to grow virus in lab cultures were devised. Like rhinovirus, coronavirus also contains RNA. So it's an RNA-based virus. However, in contrast to same, that is rhinovirus, the amount of genetic material carried in rhinoviruses, the genome of coronavirus is largest of all RNA-containing viruses. Let me just repeat this point. In contrast to same amount of genetic material carried in rhinoviruses, the genome of coronavirus is the largest of all RNA-containing viruses. And coming to its name, the name of virus derives from a distinctive flexible shape and appearance of virus, as you can see in one of the illustrations. Surface projections give the virus a crown-like or corona appearance. There are more than 30 known strains of coronavirus. Of these, 3 or 4 from the genus coronavirus can infect humans. Cattle, pigs, rodents, cats, dogs, and birds are also hosts of coronavirus, right? So this is some information related to coronavirus. And there was an interesting fact which I've come across day before yesterday, where one of the Australian mathematicians from Australia, based on the size of coronavirus and based on the infections that are present in the world currently, around 54 million, he made a calculation and he mentioned that the entire virus causing these 54 million cases and even more can be carried in a spoon. This is very interesting. So just a spoonful of coronavirus, right, causing this pandemic. Isn't that surprising? Doesn't it show how diverse this nature is, how complex it is, and how simplistic it is? Virus, less than a spoonful, causing so many cases. I mean, this is just mind-blowing. Okay, so now let's move on to WHO website. We'll review some information over there and then we'll quickly wind up this session. In the process of that, we'll try to discuss about masks, some considerations in pregnancy, breastfeeding, etc. Okay? Okay. Yeah, as you all answered, crown shaped or yes, that's true. Now let's review some information that's present in the official website and then we'll try to move on. I hope you can see what I'm seeing now. Yes, Maurya. Yeah. Before we proceed to this, yeah, I mentioned about slurry water. So why slurry water? Why should you uh, wet the cast in slurry water before you proceed to model trimmer? So what's the answer? What do you think is the answer? Anyways, try answering this. I'll get back to this at the end of the session. Okay? Right. I think you're able to see what I'm seeing. Yes. So this is the official website. Always rely on information given in official website. I mean, if you're siding with Trump, obviously you'll not be following WHO. You can follow FDA or US-based CDC. But come on, you can, of course, follow WHO. So the first page, which I'll be reviewing now is, yeah, I think you're able to see, right? So you can see this picture clearly shows that we are definitely facing a pandemic. And on left side of the screen, you can see the number of new cases. I think this is a daily update. Yeah, data last updated on 17th, 3:33 p.m. So new cases around 500,000 and confirmed cases, if you see, around 54 million, of which India has contributed to almost 8.5 or 9 million. We'll get back to those stats. And also number of deaths around, I think that's 1 million, right? 13,24,000, yes, around 1.3 million deaths. So globally, as of 3:33 p.m. CET, November 17, so we have around 54 million confirmed cases and 1.3 million reported deaths as per WHO. So the same global situation. As you can see, the number of cases seem to be increasing. And also you can see day-to-day updates and situations. We're talking about pandemic, right? So you can see Americas. So Americas, I think both North and South Americas fall under this. So around 23 million cases, Europe around 15 million, Southeast Asia, including India, I reckon. So around 10 million, Eastern Mediterranean around 3 lakh or 3 million. Yeah, 3 million, I think. Yes. And then Africa, it's 1 million, Western Pacific around 8 lakh. Yeah, so this you can see the trend. We can see a wave. You can see increasing number of cases. And right now we are in declining state, around 20,000 cases per day. Yes, and also you can see territory-wise, country-wise. United States around 10 million, India around 8 million, to be more accurate, as on today, 88,74,290. I mean, don't bother about numbers. This is only for our understanding to know the magnitude of the pandemic we're facing. And then Brazil, and then Russian Federation, France, Spain. So you can see highest number of cases. So India right now you can see declining number of cases. So on November 17th, that is yesterday, the number of confirmed cases are around 29,163. It's declining. So it went to a stage where we reported almost 1 lakh cases per day. So as you can see, almost 1 lakh, almost. And then we've come to this, I think it's declining. Or can we expect a second wave or a third wave? Right. Now let's move on to the next slide or next window. Yes. So regarding masks, so why should people wear masks? So it's all a part of do-it-all strategy. So basic social structure which we have incorporated, the new lifestyle they're talking about. Wearing mouth masks, maintaining physical distancing, and then sanitizing hands as many times as possible depending upon the requirement. So we have different types of masks like fabric masks, medical masks, and then we have these N95s. So you can find all that information over here. Yeah, previously fabric masks, they were not supported, but now they say at least something is better than nothing. And our government clearly states that yes, go with fabric masks also. Now let me just go through these respirators and medical masks. So this is some information which I want you to focus as a medical or healthcare professional. This is something which is very important to us. So medical masks are also known as surgical masks. So the composition, it has 3 layers of synthetic non-woven materials and configured to have filtration layers sandwiched in the middle. This is important. Available in different thicknesses, has various levels of fluid resistance and filtration. So we have medical masks, also known as surgical masks, and then you might have seen various medical professional or personnel wearing respirators. So respirators also called as FFPs, which are nothing but filtering phase piece respirators. FFPs, which are available at different performance levels. So N95, N99, FFP2, FFP3. So respirator masks are designed to protect healthcare workers who provide care to COVID-19 patients in settings and areas where aerosol generation procedures are undertaken, including dentistry. So this is something where aerosols are most common, isn't it? Yeah. So rest of the information, I think it's all obvious. Okay, now let's move on to the next window. Pregnancy and childbirth. So are pregnant women at higher risk from COVID-19? So pregnant women or recently pregnant women who are older, overweight, or have pre-existing medical conditions such as hypertension and diabetes seem to have an increased risk of developing severe COVID-19. So this is one point which I wanted to highlight, right? So any comorbid conditions or even pregnancy for that matter, along with specific conditions mentioned over here, they are at increased risk of developing severe COVID-19, right? And they're mentioned about various changes and also possible symptoms, which we already discussed. Now, what about breastfeeding? I mean, in case of breastfeeding, do you think the virus spreads from mother to the child or to the baby? I've come across that question somewhere here. And anyways, the answer is there is still no evidence that the virus passes through milk from mother to baby. So giving milk or a lactating child is always advised as usual. Okay. That's another question which I wanted to highlight. And some differences and similarities with influenza. I think one of you already mentioned, Neha already mentioned in one of the live sessions regarding the same. So if you find time, just go through this particular information. So how are COVID-19 and viruses, influenza viruses similar, or how are they different? So we have information over here and we'll review some information in this regard. The speed of transmission is an important point of difference between the two viruses, the one which I'm highlighting now. Influenza has a shorter median incubation period time and a shorter serial interval than COVID-19 virus. So this is one significant difference which I wanted to make a note of. The serial interval for COVID-19 virus is estimated to be 5 to 6 days, while for influenza, it is shorter, that is around 3 days. This means influenza can spread faster than COVID-19. Please do underline this point, okay? And the rest of the points, you can go through them as per your convenience, okay? Yes, serology, antibodies, and immunity. So here I wanted to highlight about herd immunity. You might have heard of this term a number of times in the news or in the current events. So what is this herd immunity? It's also known as population immunity. Let me just highlight this. Is a concept used for vaccination in which a population can be protected from a certain virus if a threshold of vaccination is reached. Herd immunity is achieved by protecting people from a virus, not by exposing them to it. Vaccines train our immune systems to develop antibodies, just as might happen when we are exposed to disease. But crucially, vaccines work without making us sick because they are attenuated versions, as you all are aware of. Vaccinated people are protected from getting the disease infection. And also, you can visit the website for more information on the same. Herd immunity exists when high percentage of population is vaccinated, making it difficult for infectious diseases to spread because there are not too many people who can be infected. And the percentage of people who need to have antibodies in order to achieve herd immunity against a particular disease varies with each disease. For example, herd immunity against measles requires about 95% of population to be vaccinated. Please make a note of this. And the remaining 5% will be protected by the fact that measles will not spread among those who are vaccinated. And for polio, but in case of polio, the threshold is about 80%. Measles around 95%, right? Achieving herd immunity with safe and effective vaccines makes diseases rarer and save lives. So vaccines are still in a stage of development, and they're talking about final trials, and also they're talking about success rates, effective rates of 90%, 95%. So let's hope we'll achieve herd immunity faster with these vaccinations and relevant protocols. Okay, and let's move on to our next window. Yeah, breastfeeding. So this is what I was trying to highlight previously. Can COVID-19 be passed through breastfeeding? A transmission of active COVID-19 virus that can cause infection, that is SARS-CoV-2, through breast milk and breastfeeding has not been detected to date. So we can't absolutely say no, there is no absolute no, but as of today, as per the studies available, as per the science that's available, no. Relative no, we can say at least. There is no reason to avoid or stop breastfeeding. Okay? So breastfeeding has to be continued. And regarding disinfecting or cleaning surfaces, so I found some chemicals and the percentage, so I put this window as well. So I wanted to just highlight the same. In non-healthcare settings, let me just zoom in. Yeah, I think I can zoom in, right? Yeah. So they have recommended a concentration of 0.1 or 1000 ppm of sodium hypochlorite. So this is something which you can highlight. And alcohol around 70 to 90%. In fact, there were questions on alcohol, the strength of alcohol in previous entrances also. So you can make a note of the same as well. Alcohol at 70 to 90% can also be used for surface disinfection. Okay, so these are the 2 points which I wanted to highlight. Please make a note of the same, right? Rest of the things I think you can go through at your convenience. And regarding dexamethasone, so they mentioned about the usefulness of dexamethasone in terminally ill patients, right? So let's review some information regarding the same. Dexamethasone, as you know, it's a corticosteroid with a wide range of anti-inflammatory immunosuppressant effects. It was tested in hospitalized patients with COVID-19 in UK's National Clinical Trial Recovery. Here is where we got this very useful information that this dexamethasone was actually life-saving in some select patients. So it was found to have benefits for critically ill patients. So this is the point which I wanted to highlight. And according to preliminary findings shared with WHO, for patients on ventilators, the treatment was shown to reduce mortality by about 1/3, right? And for patients requiring only oxygen, mortality was cut by about 1/5. So these stats, along with the usefulness or relevance of dexamethasone in the treatment of COVID-19. The rest of the treatments, remdesivir and all, there were studies saying that they were not significant in treating COVID-19. Okay. And rest of the things, I think they're not so significant. Now, I think we can conclude with this, right? So this is this is some important and relevant points related to this COVID-19. And there are still so many aspects to it. So we try to touch upon various important key areas accordingly. And I'll just project the very same window and I'll take up your questions. You have any questions, you can let me know. I'll see if I can provide you any additional information. And also, if you have any additional information, as one of you were mentioning about a new symptom about hearing loss, if you have any additional information from your side, you're more than welcome to share. Right?